Hi, everyone. Welcome again for another moment with the mayor this week. I am fortunate to have Jennifer Anderson here with us today, the City of Richfield's Community Health Administrator. Thank you for coming, Jennifer, to talk to us about the COVID impacts here in Richfield.
Thanks for having me. I'm glad to be here and share what I know.
Thank you. So Jennifer, can you tell us a little bit more about what you know in terms of how COVID is impacting Richfield specifically right now?
Yeah, Richfield is being impacted much like every other city across the state right now. On our public phone calls, we often talk about that the state is kind of on fire with COVID. Everybody that you run into is somebody that you should consider who's positive with COVID. So it helps you kind of maneuver through your day with that thought in mind. Richfield just surpassed the 2,000 mark this weekend. So we've got 2,019 people who've tested positive for the coronavirus. And we've had 20 residents who've actually passed away. And most of those being within our long-term care settings. So, we've been increasingly seeing our case counts continue to go up, as with our partner cities as well. And so we're working very hard to get the word out about, staying home and not celebrating the holidays with family other than those you live with. And practicing those healthy behaviors like washing your hands frequently, wearing your mask above your nose. It doesn't do any good below your nose or below your mouth, and being tested. And the state is really pushing the testing piece, and there are new testing sites opening up every day. So we're in the thick of it with the rest of the state for sure.
Thank you, Jennifer. And I was able to look at our COVID dashboard on our city website. That's a really great resource that our residents can go to and look at more in depth at what we're seeing here in Richfield and who is getting impacted by COVID. And what I saw on the dashboard is that the Latinx community is being disproportionately impacted by COVID here in Richfield. Do you have any ideas as to why that might be the case?
Yep, great question. And it's something that we've heard many times before, and it is those long-standing systemic inequities. It's the social determinants of health. And it's, if you don't have access to housing and healthy food and a good education and healthcare, you're going to fare worse than people who do have access to those things. And it's really as simple as that. The city is always working to get rid of those barriers, and it's something that COVID has really exposed. And so, yes, the Latinx community has suffered far worse than other groups within the city, and we're hoping that there will be data and information that we can glean from this pandemic that won't make that the case the next time something like this rolls around.
Thank you for sharing that. And I'll just add, a lot of Latino community members in Richfield do work in our service industries and are frontline workers. And we also know, just to remind our residents, that 40% of the students in our Richfield Public School District are Latino students. And so this is also disproportionately impacting so many of our youth in our city. So please do everything you can to protect yourself and your family. Be overcautious, and know that in many ways this is absolutely impacting the most vulnerable community members in our city, including our children, and that the city of Richfield, we are really doing as much as we can to tailor our resources to fill in the gaps in our COVID rapid response, and working hand in hand with our Latino community partners and all of our community partners to address those inequities that we're seeing in Richfield. So last Friday, Governor Walz enacted new restrictions that go through December 18th. Can you tell me a little bit about those restrictions?
Yep, and they're an important piece of this. So the new restrictions were put in place to limit our ability to spread COVID, with bars and restaurants and gyms and movie theaters and museums and sports being closed and curtailed, it limits our ability to gather. If we can't go to those places, we're not going to gather. And so with the 4-week pause on those through December 18th, it really kind of forces us to stay home. And that's exactly what we need people to do. It's giving our healthcare system and our healthcare workers an opportunity to not become overwhelmed. We're very close to that. We're I think just days away from possibly opening up the alternative site that would be open to care for people with COVID, because the hospitals are full, and that's kind of a frightening thought, that our hospitals are full and they can't take any more people. So by the shutdown taking place, it really forces us to stay home, to stay away from other people. And the sooner that we kind of abide by this guidance and do our part, the sooner we get out of this. And that's, I think that's an important message. People are tired of it. And the more we do our part, the faster we can do that and get to that point.
Absolutely. Thank you. Well, I have one last question. So we know Thanksgiving is at the end of this week, and people are stressed about the holiday season and if they should get together with their families or not, and what they should do. As a public health professional, what do you recommend to our residents in terms of altering their Thanksgiving plans, their plans for the holidays, to keep everybody safe and really start to make a dent in reducing the number of cases that we have right now in Minnesota?
Yeah, the Minnesota Department of Health has changed their guidance fairly frequently of late, but what they're really hoping people do is to not gather with people outside those that they live with. And so if you're a mom and a dad and your 2 kids and you live in your home, then you should only be celebrating with those people. It's really hard to think about Thanksgiving without grandparents and cousins and aunts and uncles and in-laws. But the more people you bring into the mix, the more COVID positive cases we're going to see. And that's what we're really, really trying to prevent. So what I'm telling people is stay away from your family this holiday so that you can celebrate with them next year. And that's really kind of the basic message that we're trying to get out. Your actions and the lack of gathering with family this year could literally save a life. And it's that simple. And I hope people abide by that. If you've got a smartphone or a computer with the internet, you can have your meal together with family via a Zoom conference call, and it's not going to be the same, and it won't measure up to past holidays, but it's that important to just celebrate with your own family under your own roof this year.
Thank you so much, Jennifer. Well, thank you for coming to speak with us this week, and thank you for all the work that you're doing to lead our COVID rapid response. I know you have been working around the clock since the beginning of the pandemic, and you're also responsible for working with our restaurants and all of our businesses in Richfield and our long-term facilities as well. And so we really appreciate all the leadership and all the work that you're doing to keep our residents safe, Jennifer. Thank you, everyone, and please be overly cautious this holiday season with COVID so that we can make sure that we have our friends and family, community members, small businesses, and thriving community around once this pandemic hopefully comes to an end.